Good morning, everyone. It's Nick Rebea from East Coast Transformations SA, and from our Sunday video that we recently launched, I was promising all the consumer market athletes, patients, clients, more educated-based videos that are really going to give much better insight into health, into wellness, into training, into blood work, into any issues that we may go through medically that a lot of us, specifically to males, that don't actually like to talk about. And I think it's something that really, especially the subject that we're talking about today. So when you hear the words TRT, a lot of people across the globe will know of TRT therapy. The only problem is with TRT therapy, everyone thinks they can take it. So TRT therapy is definitely not for your ages of between 19 and 25, unless you have an actual deficiency issue from puberty, or that there's a problem that has already been signaled and flagged by a specialist or a physician that deals with this type of medical aspects. So TRT, it can be commonly known as an androgen replacement therapy or testosterone replacement therapy, and this is utilized only when your sex-binding hormone, which is your SBHG, your total test and your free test, is at a significant decrease. Generally, the decrease in testosterone can be based on mental stress, it can be based on anxiety, it's a very much age-regulated basis. So when you're getting over the ages of 35 upwards, generally our natural test depletes. So, but again, what people need to realize is that generally your factors will sit. So NMG is basically your two test markers between your markers for test. So generally they sit between 170 to around about 750 NGM. Now, it's important to almost have an equilibrium of a balance between those markers. Obviously, guys that are going to be going on aftermarket anabolics, it can go as far as 1,000 and upwards, where generally to the common consumer or guy that internally wants to feel better in terms of an increased libido, increase in strength, overall, it can be even with regards to fertility issues. There's a lot of purpose and benefits that TRT therapy can do. Again, guys, TRT therapy is not just for a person that wants to ride a course. So a lot of people these days feel that while they go into a PCT, which is a post-course therapy, they feel that they can ride TRT in order to hold and balance maintenance testosterone levels. However, it does not work like that. Your testosterone and TRT therapy needs to be very specific to your medical issues. TRT at lower dosages, they're not going to make you huge. You're not going to get massively strong. TRT is specifically to internally start increasing your natural levels. So a lot of people that are getting older, generally they'll battle with lower stomach body fat. A lot of people may be going through anxiety, depression. And what happens is a lot of people go to psychiatrists and they get put on antidepressant and anti-anxiety. And there's often a good chance that you may not be suffering from anxiety or depression, and often a psychiatrist or a psychologist will put you on certain meds that actually can almost give you side effects or make you react in a negative manner in terms of your endorphins and your brain neurons. So when it comes to TRT, it needs to be very specific that you get your blood works tested, and then if it is at a level where it is almost dangerously low, then a specialist will either utilize test cream that you'll place on your ankles or behind your knee, or you'll utilize a testosterone injection like a Depo Pfizer test, or anything medical based that can be used to slowly increase your natural test. I will continue this video tomorrow going a little bit more in depth for those that are suffering, but a lot of those older men that, if you guys are getting the chance to watch this video, just be aware, if you've been battling for years, battling to lose the stomach, battling with hair loss is a common phase, battling with anxiety, depression, lack of energy, this is a direct result of low natural tests. So guys, promise you right now, before you jump into antidepressants and anti-anxiety tablets that can actually lead to further side effects and create other complications, get your free test, your total test, SBHG levels tested regularly to see where you stand and how that can be benefited by TRT therapy.